Southwest Florida. Welcome to Lee Pitts Live. So thrilled that you joined us here as we continue to educate the community on what's going on as it relates to the vaccine now. You know, people are still getting tested for COVID. In fact, I got my test this morning for COVID and looking for my results again. It's about my fourth test, and fortunately, I've been coming back negative, and I expect to be negative again because I've been practicing social distancing. I've been wearing my mask, and I've been keeping my hands sanitized and washing as much as I can. I don't do everything perfectly, but I try as best as I can, and the family does the same thing. So my wife is always nervous about me getting it, but she just doesn't realize I'm conscious of what I'm doing. Right now, I'm socially distanced right here from my good friend at the health department, Jennifer, over there at Lee Health, Florida Health. And I think it's Florida Health, but it's the Lee County version.
Yep, it's the Florida Department of Health in Lee County.
All right.
Yeah.
Okay. And y'all sort of brand the just Florida Health as the big picture, right?
Yep, that's our big state picture.
Okay. So Jennifer, let's get your full name.
My name is Jennifer Roth. I'm the Assistant Director at the Health Department here in Lee County.
And of course, you've been on my television show before. That means that you certainly are conscious of the health department, that is. It's very conscious of making sure that you reach out to our diverse communities, right?
Yes, it is definitely a priority for us, especially now when we have such the pandemic continuing and we have such a need in our community to reach out to everyone. Okay.
Well, let me set the scene here. We are here at Mount Hermon Ministries, one of the great churches in our community. We have is under the leadership of Pastor Glover and First Lady Glover. And the church has always been at the forefront of providing information as well as tackling issues that don't commonly get tackled by churches. We also have a great pastor here, Pastor Ricky Anderson. You guys know him. He's always as well in the forefront, speaking out, educating, and encouraging as well. I don't want to get the name of his church wrong. Can you shout that out to me, Pastor Anderson? Followers of Christ Fellowship Ministry, and you know I was out there a while back for the burning of the mortgage. Got that right? All right. And he'll be here with me in a second, my good friend. We go back at least 25 years, and so we got a outstanding all-star team here who will be a part of the panel discussion that will be taking place that I'll be moderating, and it'll be streaming live. We're going to get some of these hardcore Fox 4 interviews here as well. The title of this particular symposium is Who, Why, When, and Where. The coronavirus vaccination, who, why, when, and where. I love it. Since we're here at Mount Hermon Ministries, I've been told that Mount Hermon Ministries, sitting right here on Martin Luther King Boulevard, will be one of the locations in the future where you will be able to come to get your vaccination. So it's right here in the heart of the African American community, right here in Dunbar, right on the main street, and has a great reputation that people can trust. So we're going to be getting everybody out to get their vaccination. And I want to, before I get back to Jennifer, I want you guys to know that I'm looking forward to getting my vaccination as well. I'm going to touch my phone here. I'm telling everybody else to turn their phone off, but I don't want to stop. I want you guys to know this is live. Getting a call from a telemarketer. I'm going to do this on air, and I'm going to keep this rolling. I'm going to put my phone on silent on air, okay? Telemarketers calling me from Toronto, Ontario, selling me something. All right, without further ado, let's get over to Jennifer from Florida Health here in Lee County. Welcome to Lee Pitts Live again.
Thank you.
And tell us, before we get started, I know we're going to have a heavy focus on COVID-19, but tell us the mission of the Florida Department of Health here in Lee County.
So, our main mission is that everyone has an equal opportunity to access health care and that we can protect, promote, and improve the lives of the people here in Lee County.
Okay. And what are some key things that you guys address on a daily basis? I know COVID-19 is on the forefront right now, but you guys deal with mosquitoes and everything, right?
Yes, any kind of infectious disease you can think of, we probably have a hand in it somehow. Of course, we're always there giving all sorts of vaccines to our kids so they can go to school. We also do a lot in our community with trying to make sure moms have healthy babies and that people stop smoking. All of those good public health measures, those are, that's what we do typically day to day.
And you because you're in Lee County, you have a certain focus on your county, and you kind of familiar with your county, and then it all feeds up to the state and the feds, or just to the state?
Yes, we're very lucky here in Florida that the whole health department is a state agency, but we're just responsible for our county. So that means we know our county very well, but at the same time, if we need help, we can get resources from the entire state.
I would think that, I know you have a location on Michigan Avenue, and you have a location over in North Fort Myers, if I recall.
That is correct, 83 Pondella Road.
Right, I've been to both of them. Name all your locations, or did I cover everything?
So those are our two main clinic locations. We also have some administrative offices near downtown, and we also have some WIC offices, both in Lehigh and Bonita, so that we can reach people where they are.
Now, you're going to be representing the Florida Department of Health here, Lee County, in a symposium that's going to take place. Tell us about the whole process of you partnering with Mount Hermon Ministries and some other partners. I know I was on a conference call, and there was some allusion to the fact that you had one of my mugs, and then I had to, everybody who's been on my flagship show gets a mug. You can't get a mug unless you've been on the flagship show, but I've interviewed about 25,000 people, so I forget some names here and there. But I put it all together now, as you reminded me. Tell us about the partnership that you formed throughout the community, and specifically what brings you to Mount Hermon Ministries as a local spot.
So that is a great question. We've recognized, especially in, communities of color and a lot of faith-based communities, they really look to their clergy for a lot of answers and leadership. And so, we've recognized that by partnering with the clergy, we can really help get our message out there in communities that we might not be able to reach through our normal channels.
I see. And that is what you said earlier, your community. We also know that in this symposium, we're going to try to get as many questions answered as we possibly can, but I want to make sure that we tell everybody that we don't have all the answers right now. I'll let you expound on that. Go ahead.
Yeah, no, that's a great point. Right now this is still new. We've only had the vaccine for about 2 months, and it's actually less than that in Lee County, probably only 6 weeks. So there's a lot we're still, learning about how to get the vaccine out there. We know there's a lot of great research that's been done to make us feel confident about the vaccine, but there's always, questions that can be answered or lessons we can learn better.
Now, you said something about we've only had the vaccine in Lee County about 2 months. When you say we, who is we?
So the vaccine actually is from the feds. The federal government has the vaccine, and then they send it to all of the states. And then the state will send it to each county, and they give it to hospitals, health departments, pharmacies, all of that. So the first time, the vaccine came to the hospital and the health department from the state office was about the last week of December. And so that came to both the hospital, the Lee Health hospitals, as well as the health department for us to be able to start vaccinating our frontline healthcare workers at the time.
Okay. Are you considered frontline?
Yeah, so if you work with patients where you might be exposed to COVID by your normal job duties, that's what we consider frontline. So I have been out there in the field helping test people and helping getting people vaccinated. So in those situations, I'm frontline.
Okay, don't feel guilty. I just was going to follow up with, you've had your first vaccination then?
Yes, I got my first vaccination at the first clinic I worked at, yes.
Okay, and then you got to go back for another one, right?
Yeah, so it's 28 days later you get the second dose. So I actually just got my second dose.
Okay, as a human being, not as a health department person, but as a human, how was that experience, and any side effects? How you feel about it?
I was really excited. My background is science, it's biology, and so this is, newer technology that's been used to create the vaccine, but it's actually been around for a long time. So I was excited to be a part of history, to be honest with you. And then, after the second dose, I had a few side effects like aches and, I felt a little warm and achy for a day or two, but then I felt great.
Okay.
Yeah.
So you had your second dose, I think you just said?
Yes.
Okay, so you good to go for a
Well,
while.
So after the vaccine, you'll see I'm still wearing my mask, even though I've had my vaccine. We do still want people to follow all of those good measures like masking, social distancing. No vaccine is 100%. This vaccine is pretty darn effective. It's about 95%. But we want to make sure, not a lot of people are vaccinated yet. So we don't want to contribute to any more disease transmission. So until we have more research about that, even if you're vaccinated, we still want you to wear a mask and social distance.
Now, I think I heard on the news or something. I think they said the vaccine was to keep you from getting sick, but it doesn't keep you from getting the virus. You could have the virus, but you won't get as sick. Can you expound on that as best you can?
So
right.
That is the one unanswered question we have. So we know that the vaccine does a really good job of keeping you from getting sick if you're exposed. However, if you're exposed to the virus, is that virus still up in your nose and your mouth so that when you cough and sneeze, you spread it to someone else? We call that an asymptomatic carrier.
Okay.
So that question is still to be answered. We don't really know how effective the vaccine will be yet against people who are asymptomatic carriers. We know it'll help you not get sick, which is what we want, but we don't know how much it'll impact transmission just yet.
Now, the health department, have a propensity or a strong interest in making sure that the vaccine gets distributed fairly, and certainly that people who live in particular communities, when they have a place to go get their vaccine, that the people in those communities actually get those vaccines.
Yes.
Talk about that.
Yeah, so right now we can only vaccinate people who are healthcare workers or 65 and older. And we get, like I said, a limited supply each week comes from the state. And because it's so limited, we really have to make sure we can target where it's going. As you know, we have our large airport site where people can make appointments, but we have recognized that, some people might have a bit of a challenge getting out there, or, may just not want to do that. They might want to be more comfortable in their own home community. So because of that, we've decided that we're going to meet people where they are. And when we get allocations for the vaccine, we'll make sure that people who have access issues, transportation issues, whatever it is, we'll make sure we meet them where they are in their community.
Now, as we sit here on February the 3rd, as we sit here on February the 3rd, do we have any idea of the next shipment, or rough idea within the next 15 days, the next 10 days? Do we have any rough idea when we're going to have some more vaccines in this area? That's
a great question. So we get vaccines about once a week.
Oh, okay.
But the thing is, we never really know until the end of the week how much we're going to get for the following week. So the state doesn't usually tell us until about Friday what we're going to get for the following week. So it is a little bit hard for us to plan very far in advance because the number of vaccines that we get week to week does change. And it really is. But again, the state's also sending vaccine to all of the Publix pharmacies in the community. So the number of vaccines coming to the county remains pretty stable. But how much comes to the health department, how much goes to the hospital, how much goes to the pharmacies, those numbers change week to week.
Well, let me just kind of get some normal, everyday walking guy questions in, because that's what I try to do with this television show. So you mentioned Publix and pharmacies. When I think about a pharmacy or Publix or a place like that, I think about, that's a prescription. I got to go pay some money to them to get a vaccination. Or do I need a prescription to go and get it and put it in myself? All these kind of things go as it relates to pharmacists.
So pharmacists are absolutely able to give vaccines. They give a lot of flu shots every single year.
They physically do it for you?
Yes, they do.
Okay.
Yep. And so I know Publix has an online reservation system, but the federal government has ensured that this vaccine will be free for everyone. So there is no payment. There is no prescription. You just have to try to get yourself an appointment.
Okay. Let's go to appointment. I don't know all of this because I haven't tried to make an appointment. I'm not old enough based on what they're saying now. And I hear them saying, that is the new president, Biden, that he's want to get to the point where it's not based on any criteria, age, whether you're in a healthcare facility or assisted living facility, any of that. We just want everybody to have opportunity to get vaccinated. That's down the road. But as it relates to right now, I keep hearing all of these problems with website, problems with registering, problems with it's blowing up. The site is, what's the word, failing or anyway, when the
Right,
site
when
goes
the sites
down.
crash.
Crash,
Yeah,
crash.
Yep.
All right, so go ahead and speak to that.
So honestly, the biggest problem we have is that we don't have enough vaccine for the number of people who need it or want it. So, we have about 250,000 people in Lee County who are either 65 and older or a healthcare worker. And this week we're getting about 2,500 doses. That's just the amount the state can allocate to us based on what they're getting from the federal government. So 2,500 compared to 250,000, that's only 1%. So each week we only get about 1% of the total population who could be vaccinated. So the demand really just outweighs the supply.
You still encouraging people to go online and try to go where to register?
Yeah, that's actually a really great question. So the state has a new website for pre-registration because we recognize that these appointments, trying to get an appointment has been, really tough on people. So now anyone who's 65 and older or a healthcare worker can go online to our pre-registration site, which I can share with you if you want to put on your website. And then that way people can go ahead and just pre-register.
You can't call that out right now? You don't know off the top of your head?
So I don't want to get it wrong because it's a very specific. It's not very long. I just don't want to get it wrong on air. But I will look that up for you. And
we'll certainly say it during the panel discussion.
Yeah,
you need
absolutely.
to have that.
Yes, absolutely. So people can just go online. They can pre-register, and then once appointments are available and more vaccine comes, they just start calling down the list of people so you can reserve your spot.
Okay, so to your knowledge, if one goes to, I want to have that website linked to the LePIS Live page, we'll get on that. We got a lot of traffic on the LePIS Live. Maybe we can have it over there too where people can click there and go there. But if people go to your Florida site, your Florida Health Department site, Lee County, is there maybe a place there they can click?
Yep, absolutely. Yep, we have all the information on our local website as well.
Okay, so we're telling you all that right now. Okay, you think that the infrastructure has been improved in terms of the crashing and all of that? People, the tech gods have started looking at these things?
Yes, so the good thing about the pre-registration site is it doesn't guarantee you an appointment right here, right now, but it gets your spot in line. So rather than competing for only 2,000 spots, there's infinite number of spots. You just have to sign up, and then when the vaccine comes available, we start calling down the list in the order of people signed up.
I remember it being said that you can't keep people from traveling into different communities and getting vaccinations. And of course, if you guys announce when the vaccines are in place and when they're going to be happening, you're starting to see people camping out overnight and all of that. And specifically, and it's no secret that when the vaccinations were being given out at the Stars Complex here in the African American community, you saw a whole lot of white people on lawn chairs and everything coming for the vaccination. I don't blame them for coming for the vaccination, but people like, hey, they're coming in our community getting a vaccine. Should people view the vaccine as being, because it's in their community, that they should be the ones who have priority to it?
Well, and so we do have a new rule in Florida where you do have to at least be a Florida resident in order to get the vaccine. And then the good part about the pre-registration is that when you sign up, the list goes to each county of where the people signed up. So when we start calling people for those appointments off that, we're only going to be calling Lee County people. So at the very least, we can make sure that we're not having people coming in from outside of our county.
Okay, let's kind of wrap this up. Let's come to Dunbar, the largest African-American community in Southwest Florida, certainly in Lee County. Mount Hermon Ministries has been identified as a official place to come and get vaccinated. What does that do in terms of targeting a community that really needs to be targeted, African Americans and minorities? Yeah,
well, and so that's the thing. We have the pre-registration website, but we recognize that list is long, and we want to meet people where we are. And we know the African American community has been disproportionately affected by COVID. We know that there's higher risks for people who are Black who get COVID. We do not want them to be at such a high risk. So, we're really happy that Mount Hermon Ministries is here so that we can get them that site. And, the Department of Emergency Management actually has a faith-based program where they come to different churches. And so that's what Mount Hermon signed up for. And so hopefully in the future we'll be able to get some vaccines here.
That's going to be a huge help. And it's also been the whole stigma about people not trusting the government, not trusting putting medicine in their arms in general, You know, there's some cite the Tuskegee experiment and all that, which I see as a totally different thing. And Tuskegee experiment was more of a secretively done. It wasn't in the public eye. It was like 1937. Technology wasn't what it was back then. Information, the education, the black scientists, and all of these other factors that are different here in the modern era. But still, there's that apprehension, particularly in certain communities, of people not trusting the government, not wanting to get vaccinated. I'm saying this to say that if everybody doesn't participate, the experiment of getting our country vaccinated, it could drag that process down because they still can be spreaders and catchers of the COVID-19. I said a lot. Go.
You know, I'm actually from Baltimore originally, and when I worked there, I worked in research, and it was obviously primarily African American. And so my job was to help get people enrolled in research for kidney disease, HIV, all sorts of things. And so I tell you, 98% of the population that I worked with was all African American. And the one thing I learned is that you have to be honest and you have to be transparent. You have to show them all of the facts in order to gain that trust. And I think you're right. I think, you know, we want to make sure that people realize this is about science and nothing else. And so that's why I'm just really excited to be here today.
Okay. Well, we're looking forward to having you as part of the panel discussion, live streaming live here from Mount Hermon Ministries this evening at Mount Hermon Ministries' various social media sites, including YouTube, the Mount Hermon Facebook page, Facebook, and the like. So we're going to go to a break. When we come back, we'll be talking to another prominent pastor in our community, the Reverend Dr. Ricky Anderson. We'll be right back.